Hi everybody, it's Bethany, and this is the follow-up video to my skill assessment video that I posted last week. Today I have my daughter Maya as my student and my son Liam as her patient. So she's going to go ahead and start with his health history questionnaire and we'll get going.
Hi Liam, it's great to see you today. I want to start off your airway assessment by reviewing your medical history and sleep questionnaire. It doesn't look to me like you have any major medical issues, but I do see on the questionnaire that your mom notices you snoring in your sleep. Are you aware of this?
No.
Do you notice feeling sleepy during the day?
No.
Okay, I'm going to take a look at your mouth and airway to see how things look.
So at this time, Maya's going to go ahead and perform Liam's clinical exam. She's going to be taking a look at all his occlusal surfaces to see if he's got any wear from bruxism or acid erosion. She's also going to be checking for scalloped tongue or a tongue tie. And then she'll be evaluating his airway and recording his Mallampati score. And then she's going to end things by taking a look at his neck circumference and his nasal passageways.
Okay, Liam, based on my clinical exam, I don't see any major concerns with your airway. Your teeth aren't showing any wear, your tongue looks normal, and your neck and nasal passages look really healthy. I did notice that your airway was hard for me to fully visualize with my eyes. That might possibly be connected with the snoring your mom mentioned in your paperwork earlier. I would recommend your mom taking you to see your pediatrician to evaluate this further. Do you have any questions?
No.
All right, Maya, you did a really great job with this. So when I was looking over the feedback form that I filled out while you were completing this skill, I really think that you did a good job handling yourself professionally. You definitely looked professional, and you showed your patient a lot of empathy and respect. As far as the airway assessment itself, I think you did a great job with that too. You took the time to review your patient's health history and their sleep questionnaire. I do think that you could have spent a little more time interviewing your patient to ask them questions about their sleep quality and their breathing and things like that. But your patient was 8 years old, so that would have been a hard conversation to probably have with him. I think that you did a wonderful job performing your clinical examination. You hit all the high notes there. I saw that you were looking at his occlusal surfaces for areas of wear. I saw that you took a really good look at his tongue to look for any abnormalities there. And I know that you were looking at his airways, and in addition, you were looking at his neck circumference and his nasal passageways. So good job with that. And then as far as your patient education, you did a really great job with that too, considering that you're pretty new to this information. You definitely advised your patient of your clinical findings, and I definitely saw where you were relating your findings to the results that your patient was giving you in the health history review. So you did a great job connecting the dots there. And then I also saw where you were recommending your patient to see their pediatrician, and that was a great call to make. So I think that was really smart. I definitely think that the information that you shared with him was correct and it was factual, and you definitely showed that you were connecting with your patient really well and developing that rapport and a great relationship with him. So you did really well. For this formative assessment, I think that you showed a lot of growth and improvement in the time that you've been learning this, and we'll take a look at this again in a few weeks and we'll go ahead and do your summative assessment, okay?
Okay, thank you.
Any questions for me, Maya?
I don't think so.
All right, thank you.
Thank you.